Road traffic crashes are the #1 killer of children and young people worldwide. The rising number of fatalities across Jamaica, a public health concern. Hi, I'm Kediesha Watkis, and this is the Wellness Beat. Today we'll be talking about road safety and the intersection of substance use. Is there a link? If so, to what extent? To help me unpack the subject, I'll be talking with Mrs. Paula Fletcher, Executive Director of the National Road Safety Council. And for added perspective, I'll be later joined by Mrs. Atkinson, Senior Director, Research and Policy Development for the National Council on Drug Abuse. Hi, Mrs. Fletcher, so happy to have you.
Hello. Good that I'm here, very important topic.
Extremely important. Where are we with the numbers? The World Health Organization says that road traffic crashes the #1 killer of young people and children worldwide. Where are we with that?
And adults as well. Well, compared to last year, we're 10% down. So today we are 268 compared to 300 last year. So it's a big number.
It's a big number, and
yes.
We seem to be pushing the envelope as the months and the days go by.
Yes, well, a feature of the crash events for this year are multiple fatalities. So for one crash event, sometimes you have more than 2 persons dying. So we've had that, and we're concerned, and we have ideas about how we can stem it. We just need to get the persons behind the policy and the finances to put various interventions in place. But there's a number of things happening, and we're just hoping that there'll be some sort of convergence so that we can improve the situation with crashes on our roads.
So let's talk about some of the behaviors driving the numbers. Are our drivers distracted? What accounts for this? The multiple fatalities, the prevalence of our road traffic crashes?
Yes. Well, the police tell us, looking at the statistics, that it's mainly speeding. And then the other reason they give is following too near. We believe at the council that, and you know, some people say Jamaican people are indisciplined. We're often not more indisciplined than any other country, you know. It's just that the laws hold and the penalties will bite. And even when people complain about how high the penalties are, if you don't commit the offense, then you're not charged. So it's very important for us to have a system of electronic surveillance to stem the type of behavior, wanton disobedience of traffic lights. You see people,
yes.
taxis going through the traffic light.
Yes.
I mean, they're, you know, good amount of feet before the light, and they're racing towards it with no care for the fact that others may be coming when it's their turn. So a lot of that is causes conflict in the traffic environment. Just disobeying the rules of the road. Not just traffic signals, but stop signs and the speed limit. And you know, we have this way of, they call it undertaking, you know, when you go to
yes.
the wrong side.
Yes.
So it's both overtaking and undertaking.
Right.
As
we
Jamaicans
have persons
say.
driving on the soft shoulder.
That's right. So there's a lot of indiscipline, which mainly points to the need to enforce the law and for the law to go full circle, which is that you have to pay a penalty if you choose to be in disobedience of the rules of the road.
Right. And I heard you earlier mentioned speeding. I'm interested though in terms of the national data. Is there any indication of the influence of alcohol or any other psychoactive substance?
Right. Well, that's a concern for us because we do have a culture of drinking in this country. And of course, with what we see with the other recreational drugs, the Molly and so, we believe that there is that in the traffic environment, and perhaps a mixture of the two. Sorry. And the issue is we have to be able to test. We have to have the ability to test. Yes, we have a breathalyzer program, but it is unfortunately not operating at the optimal level because some of the equipment, the evidence-based machines are not working. So we can't say even the level of alcohol that we can test for in the law. But currently, for the other substances, cocaine, Molly, whatever it is that people are taking, we don't have that capability, but the law actually allows for that to be done. So we're actually in a discussion with the Ministry of Health for them to help us along that way, so we can test not just for alcohol, but for other substances that may be on board.
Right, and that's an excellent partnership with the ministries of health and wellness, transport and works.
But there are member organizations, of the National Road Safety Council.
Yes,
so they sit around the table with us when we're discussing the strategies, and they understand what their remit is in terms of various activities.
Yes. I'm interested in a further breakdown of the statistics. And globally, we're told that 2/3 of those affected by road traffic crashes are working people. We're talking about those between the ages of 18 to 59 years old. What about the breakdown of male versus female? Is that something that
yes, we have those figures. Of course, you really should relate it to the total population of female drivers and total population of male drivers. That we don't have. But just looking at the straight figures of the fatalities that are recorded by the police, 85% are males and 15% female.
Wow.
Yes, so
that's a huge graph. When you said 85,
right?
Wow, 85% of our males
are dying on our roads.
Dying on our roads.
Yes, and it's not unusual in various countries that what we say, some of us road safety practitioners, is that speeding and testosterone is not a good mix. Wow, speeding and testosterone, because we know our men have that natural drive, the for
natural
energy and the ego, and they're made like that, to be able to go out and provide for the family and all of that. But if you use it on the right side of the track, it is fine in terms of their development for the family and so. But when you use it, in terms of trying to do better in terms of the time they take from point A to point B, then it becomes a hazard.
A clear hazard. And so certainly we must take action. We must take action. And I know the National Road Safety Council has a tall order.
Oh, we do.
Talk to me about some of the work that you have been doing and programs to come, because we must be able to stem the tide of this problem.
Right. Well, if you go way back, 1995, the breathalyzer program, we were very involved in that. 1999, the use of safety devices. And since that, we were sort of the pushers for the total rewrite of the Road Traffic Act, to modernize it and to look at other offenses perhaps that we should have in. Of course, the fines were very minimal, so but it does have in other features that sort of improve. For instance, electronic surveillance is a part of the electronic enforcement, rather, is a part of the law now.
Right, and could you just give us some of the details in that? Because I know we have now transitioned into using some machinery in terms of being able to even account for our traffic tickets and so on. Can you give us a little bit more about that electronic focus now? Because the technology has got to come on stream.
Right. Well, the police are very actively involved now in improving the collection of traffic tickets, the traffic ticketing system. They have a database that they can use even their phone on the road if they stop you, and if they get your license
plate,
your driver's license number,
they can run that.
They can run that and query the database to find out if you have a warrant out, if you have tickets unpaid, and that sort of thing. We also have a standard for a tire standard, which is an international tire standard, which was not there before. The whole way in which we train drivers is a little different now.
Okay.
One of the biggest things is up front, you have to pass your road code. Previously, if you have a date to drive for your license, you would run and look at your road code. But to get that permit up front, you have to pass your road code. And it makes sense because you should know what obtains in terms of the rules before you go behind that steering wheel. Okay. So those are some of the things that we have. Other matters which we don't hear so much about, the transportation of hazardous materials. There was a total rewrite of that to more conform to UN standards. So those are some of the things. You're supposed to have your driver's license on you while you're driving, but if you don't, if you just give them the information, the police have their smartphones and soon they'll have tablets
to be able to
in the field so that they can use the electronic systems.
Right. So clearly technology is coming on as a greater focus for the National Road Safety and to support the work of the National Road Safety Council.
Right. And I should mention, sorry to stop you, it's very important. If you don't pay your tickets, you won't be able to do certain types of business with the government.
Okay. I think I will have to invite you for a part 2.
Yes.
Right, because on the other side of the break, I'll be talking with Mrs. Atkinson. She's from the National Council on Drug Abuse, and we'll hear more about the intersection of road safety and substance use. Can't believe that's all the time we have with you today,
already,
Mrs. Fletcher.
There's so much more to say.
Yes.
And there are a number of initiatives too that are on board, as I mentioned. So we're hopeful.
Yes.
I didn't get a chance to mention that the World Decade, second decade of action.
Yes.
We are trying to implement that to be 50% on the deaths for the decade, which ends in 2030.
And we're actually going to get into a little bit of that when we talk with the National
because that's very important
on drug abuse. Thank you so much for joining us on this first segment of the Wellness Beat, and we'll be right back. And we're back with you here on the Wellness Beat. I'm your host, Kediesha Watkis. We've been talking about road safety and substance use. And earlier we talked with Mrs. Paula Fletcher, Executive Director of the National Road Safety Council. Now, for greater insights on the matter of substance use and road safety, I'm joined by Atkinson, Senior Director of Research in the National Council on Drug Abuse. Welcome, Thank
you for having me.
Such a pleasure. I had quite a riveting talk with the Executive Director of the Road Safety Council, and we talked a little bit about substance use and road safety. What I want to know from you is how prevalent is driving under the influence, especially alcohol or any other psychoactive substances?
So the National Council on Drug Abuse conducts a number of studies among the general population, looking at, what's the nature of drug use and what are the risk and protective factors. The most recent study that we've conducted revealed that approximately 18% of the population has driven, between the ages of 18 to 65, have driven under the influence of alcohol, compared to 10% of the population reporting that they drove under the influence of other drugs, illegal drugs in particular.
Right.
Now, when we break this down and look at the male-female disaggregation, it's a different picture. What we're seeing is that a significantly higher proportion of males, up to 25% in the different age groups, report that they've driven under the influence of alcohol, compared to 5% of women. And when we look at the particular age groups where it is highest, among males we're seeing between 18 to 29, and among females the highest reported driving under the influence is between 30 to 34 years. So, there's definitely an association between driving under the influence and the higher risk of road traffic accidents.
And it's so interesting that you gave me that breakdown, because earlier when we talked with Mrs. Fletcher, she pointed out that 85% of men were the ones impacted by road traffic crashes. They were the ones being affected, compared to 15% of women. And so we find that particularly interesting. What is the impact of these substances on the brain?
So we have to understand that, any drug use at all changes or can change the way you think, the way you behave, your perceptions, a wide range of impacts. And it is also important to understand that depending on the circumstance, it can impact us in a different way. So depending on whether you're male or female,
right,
depending on the amount that you take, but depending on the weight, your body weight, your environment, the mood that you're in. But more broadly, we have different kinds of substances that impact the brain in a different way. So for instance, depressants. Alcohol is a depressant, and alcohol slows down the messaging between the brain and the body.
Okay.
And so under the influence of alcohol, we can have impaired perception, we can have impaired judgment, we can have slower reaction time, so that's a depressant. For stimulants, things like cocaine and nicotine and caffeine, they speed up the messaging between the brain and the body. And therefore you can get things like anxiety and talkativeness, and you just rolling with energy. We also have hallucinogens or psychedelics, which is, you talk about things like the mushrooms and LSD and so on. Those things alter perception. They make you see things that are not there, or they can make you see things that are not there. We have to also talk about cannabis, ganja, marijuana, right? Because people are driving under the influence of that. And that is in a class in and of itself, because depending on the user, marijuana, cannabis, ganja, can be a stimulant, it can be a depressant, meaning it can speed you up, it can slow you down, and it can make you see things. So depending on the person who uses and the strain of the cannabis, it can have a different impact on you. But the bottom line is, you don't want anybody behind the wheel of a car or a vehicle or a bike under the influence of substances, because it's not only a risk to their own safety and their own health, but to that of other road users.
Passengers and
Exactly.
road users.
Exactly.
And so clearly this matter of substance use is all part of the entire concept of distracted driving.
Yes,
It is
absolutely
clearly playing some part. Now, statistics from the Jamaica Injury Surveillance System inside of the Ministry of Health and Wellness for the period 2016 to 2020 and also 2021 found an uptick in road traffic crashes during the month of December. I wonder whether the National Council on Drug Abuse is seeing any kinds of trend with substance use for that same period in the month of December. We know December is known as the silly season. We're all excited, we're all happy. We throw all caution to the wind.
Yes. So,
is there any relation?
Okay, so we know, as you have just said, there are parties, there are limes, there are dinners, and people are consuming more alcohol, more drugs, because it's not just alcohol, other drugs as well, during this period. Now, as to whether the road traffic accidents are directly related to that intake or that uptick, we would have to be able to quantify the proportion of accidents and the blood alcohol level and to be able to say there's a definitive relationship.
Right.
But knowing what we know about the uptake and the increase in use around that time, we absolutely assume that there is an association, because we see it. We see people leaving parties barely able to walk and going behind the wheel of a car to drive home. We have heard of events where persons have left totally intoxicated and they end up in the middle of the road, passed out behind the wheel of a car. You know what I mean? So there are definite indications that the increase in road traffic accidents during December is directly related, but we don't know the actual number. We would have to be testing.
Right.
Which brings to mind the need for our laws to be the greater enforcement
Enforcement.
of laws and strategies.
Yes.
The NCDA on our part, we do, you know, we are tasked with public education,
Right.
skill building, prevention among young people and so on. But with adults who we know are going to drink, I mean,
Yes.
in a perfect world, you would say, don't drink, don't drive, don't use drugs, don't drive. But people are going to do it.
Right.
So the approach we take with adults is a harm reduction approach, where instead of saying don't, you try to help people to understand a safer way to do what it is you're going to do anyway.
Right.
So find a designated driver if you're in a group.
Yes.
You don't drive. Give somebody the task
Yes.
who will not be drinking as much as everybody else, and let them drive. Or take a water break throughout the night. Because what we find that happens in Jamaica and in other countries, the Caribbean and otherwise, is that when we go to these events, we do what is called binge drinking.
Binge drinking.
Binge drinking is 5 or more drinks at a time within 2 hours for men and 4 or more for women. No.
And I think I may have to bring you back for part 2 to talk about some of these behaviors that we're seeing among the members of our population as it concerns substance use and road safety. Unfortunately, that's all the time that we have today on the Wellness Beat, but I'm so happy that we could have started off with this conversation, road safety and substance use. And I'm happy to have had you. Okay, gonna have to take you back for part 2 so that we can finish up the conversation. Thank you so much for joining us on the Wellness Beat. I'm Kediesha Watkis.